It's flu season, and standard flu and H1N1 flu have been all over the news. What I want to address today is what we can do in terms of preventing the occurrence of flu, because obviously prevention is the best medicine. Everyone knows the standard things to do in terms of flu prevention. Washing your hands on a regular basis. If you do sneeze, sneezing into your arm as opposed to onto your hands. Making sure that you're getting adequate sleep, adequate nutrition, and in general, taking care of yourself, not getting run down. One thing in particular that we need to pay attention to is vitamin D. Vitamin D, we know, helps support the immune system. And we have found in our practice that about 80% of our patients, when we've been measuring vitamin D in them, are deficient in vitamin D. One of the things you do need to keep in mind about vitamin D is that it is a fat-soluble vitamin, so it is possible to get toxic on vitamin D. And so we really want to have vitamin D levels measured. Vitamin D is made generally in the skin by exposure to the sun. However, we get remarkably little exposure to the sun, even during the summer, because we spend most of our time working indoors. And when we do go outside, we put on a lot of sunscreen. Most importantly, what we want to talk about today is that it clearly enhances the functioning of our innate immune system. And the innate immune system is what's necessary in order to protect us against bacterial infections and viral infections. So getting good vitamin D levels in our system is really critical in terms of maintaining good health, or optimal health, which is really what the goal is. So rather than shoot for a vitamin D level of 30 as measured by the LabCorp values, we're shooting for 50 to 80, which we believe is the ideal levels. If your vitamin D levels are low, that also means that you tend to be more susceptible to colds and flus and viruses. So what we want to do is give you vitamin D supplementation. The vitamin D supplementation I recommend, and I take personally, is vitamin D3. We've been using vitamin D3 from pure encapsulations in our practice for several years at this time. Our experience has been that when we give this product to people and we remeasure their levels, we find that the levels come back up. But more importantly, we find that clinically people feel better. There's a number of things that vitamin D does, but in this particular case, we're looking for enhancement of the immune system, and we're looking for cutting down on the number of colds and flus that you get every year. So taking vitamin D is one way that you can help make sure that you stay healthy this winter.